Hello everyone, warm welcome in Emotion of Life. Emotion of Life is an online platform for OCD recovery and cure program. We work exclusively on OCD management without medicine with CBT, ERP, REBT and holistic approach for OCD recovery. We have a specialized therapist psychologist to work together on our OCD issue related with contamination OCD, religious OCD, sexual intrusive thought management, checking and rechecking OCD, harm OCD, pure obsession, along with other multiple OCD and other subtype of OCD. We prefer to take client from severe and chronic form of OCD with medication treatment failure, in other words, who have poor prognosis after years of psychiatric medication and other psychological intervention. My name is Shyam Gupta. I'm a senior psychologist and OCD therapist. I'm working only with OCD client exclusively for more than 22 years with my other teammate. Let me share with you our experience with new client who visited our online platform, what they say when they initially come for discussion. Lot of people come to us with question like whether my OCD is curable, is it a serious mental disorder, do we need to have a brain surgery, do we need to have a continue our lifelong medication, do we need to do TMS, should we start other treatment modality like homeopathic medicine, Ayurvedic medicine, whether we will be ever able to come out from this OCD long due issue ever as a recovery, whether it will convert other psychotic symptom, is it a lifelong issue? Is there any hope for our OCD recovery, etc.? OCD sufferer ask such endless discerning question because of multiple treatment failure with a different psychologist, psychiatrist for many years. OCD is a thought process, perception, and cognitive issue. That means how a person is seeing situation, how they are analyzing things happening around in their life, how they are interpreting situation and incidents, how they are storing information and learning in day to day, and how they are using those information and learning to deal with day-to-day life in reality. Let's understand OCD in simplest way. We all know OCD has a three things. First thing is obsession, second thing is the compulsion, and when both keep happening continuously in life, it start affecting life as a disorder because of non-functioning functionality of a sufferer. Let's talk about obsession first. Obsession are those thought and belief which we as a sufferer know that these thought and belief are illogical, irrational, not corrected and true. But these thought and beliefs are such a complex and rigid. Even as a OCD sufferer, we know that these thoughts are not true, real. Sufferers are not able to come out of those chain of thought and form beliefs. In fact, once these obsessive thought comes in our mind, these thought create anxiety, and to get rid of anxiety due to this obsessional thought, we as a OCD sufferer do a certain compulsion as a act or ritual. Now, what is compulsion? So, compulsion are those action that we do as a ritual to reduce our discomfort and to reduce the anxiety created by obsessional thought. There can be endless number of compulsion in sufferer life based on their OCD pattern. The most common compulsion act done by a person in OCD is continuous and repetitive hand washing multiple times, continuous bathing for hours, spending hours in cleaning the bathroom, cleaning household item like kitchen, sofa, door knob, and other home appliances. The second type is checking and rechecking mobile and other electronic device, whether their laptop is shut down properly, whether their mobile they have sent something inappropriate image or in a word in mobile device to others, checking gate knob, cylinder knob, water tap, and car lock. The third common one is doing repetitive and constant worship because of fear of God, as considering they may have offended God because of incorrect worship process or any of their work will make God angry, or if they will do worship more, God will not help them. If they will not do worship more, God will not help them in their life. The fourth one is as a common compulsion is counting in mind, rearranging things in certain order, avoiding certain number to speak, spell, because of belief something bad will happen in their life and family if they use those word and digit. Asking for validation is a common compulsion out of their uh, safety need and safety feeling, whether they are safe or their other family member is safe. So that is related with safety behavior. Reassurance seeking from surrounded people, whether they are whether they have harmed someone or if somebody will harm them. That comes under the harm obsession. having constant checking of their health related status with different investigation under health OCD, like blood assessment, uh, ultrasound, X-ray, MRI, CT scan, to just validate whether they are fit or fine. Even their doctors said multiple times that they don't have any issue. People with a health obsession will keep continue doing these things as a out of compulsion. Fear of harming children in this type of OCD, sufferer always ask from their caregiver or family member, what if they have harmed any children? Trying to validate their sexuality, another type of obsession, their sexual orientation, and having doubt over their own gender. The next one is doing things in perfectionist manner as approach, trying to doing things multiple times as long as it does not get satisfied, as things and tasks isn't perfectly done by them. Avoiding new tasks during a certain timing in clock, as they consider some odd and even number times in clock is not appropriate to start any new work. Under the multiple OCD, person may have more than 2 to 3 OCD subtype. For example, including checking and rechecking, contamination, religious obsession, and sexual intrusive thought. Another so these are the common compulsion done by a person going through with the OCD. One may have one type or may have a multiple mixed type. It's depend on person. Once a person with OCD do these compulsion or act, they feel less anxious, and this reduction in anxiety and discomfort and feeling of calmness can be achieved by performing the ritual 2 to 3 times, or in some cases doing it more than 20 to 30 times in one go or more, which is again depend on a person OCD pattern and their complexity and their history of obsession, like how many years they are suffering with this, how much it has become as a complex. After doing compulsive act, this state of mind being less anxious can remain for a few minutes or seconds. Again, it varies person to person depending on person OCD complexity. Let's talk about cycle of OCD. In OCD, once we settle with our anxiety after doing certain compulsion, again the obsessional thought pop up and come up in mind. It again create anxiety, distress, and discomfort. And again, person with OCD do a compulsive act to get rid of the anxiety. So throughout the day, in most of the cases, they are engaging in obsessional belief and doing the compulsion to get rid of the anxiety. So OCD has a vicious cycle of obsessional thought and compulsive act. That is how it become a complex in human life. It is better to understand OCD as a thought process, cognitive and perception issue, not as a mental disorder or illness, because the perception about what disorder and illness make a person labeled with the OCD, that is called the self stigma that they are having OCD. What do we need to do get rid of obsessional thought and compulsive act? As we understand in my uh, explanation that these thought and belief are illogical and irrational, we need to deal with those entire obsessional thought chain with rational thinking and logical pattern framework. Person need to learn new socially adaptive belief system during the recovery journey as a process. Person with OCD need to learn those belief and practice which is already in use by others in surrounding and then practiced by others like in our family, society, and community. To solve to solve OCD issue, we need to put all these problem situation in a list form, which we are facing as a problem in a document that is called as therapy blueprint document to start this recovery journey under cognitive restructuring process, which is a part of CBT with us to get recover and cure your OCD in systematic manner. Cognitive restructuring is a process that requires constant discussion, explanation with your therapist on your issue and belief system. Trust me, it is not impossible to get rid of OCD, get rid and overcome OCD. It required to get work done with your therapist and follow the recommendation and complete assignment as tasks given by your therapist within timeline by client during your customized therapy session and recovery journey. Thousands of our clients from different category of OCD along with multiple OCD recovered and stable without any medication and recovered in a projected timeline. Even if you are on medication, our first target of our system is to make you able systematically so you are able to leave your medication dependency by the end of mid journey of your recovery process, which is usually take 2 months of initial session. All those who have recovered from OCD in our system in past shown their extreme level of dedicated effort, sincerity during complete therapy process. Let me tell you, around 20% of our client recovered before projected timeline also because of mutual effort by client, therapist, and family member. All the very best. Get connected with us if you are also looking for recovery from OCD long due issue. We provide without medicine 100 days, 100 session, 100% OCD recovery program, which is based on scientific process, evidence based, and based on best practices that take around 4 months to complete the process. We can assure you 25% of recovery each month, and by the end of 4 months, with your consistent effort by you and your therapist, you will also be free from your OCD issue. OCD recovery and cure is a process that require your complete commitment, strong urge, and trust in process. In case of multiple OCD, you may need one more month additional session. That is okay. After 100 session in 100 days with relapse management after recovery state to achieve OCD cure state, client require 3 month free follow-up session weekly or bi-weekly with us. So you never fall back as a relapse ever in future. Our recovery is 100%. OCD recovery is 100% possible without medicine because we have seen millions of people across the world continue with medication and keep their OCD issue with them. OCD require a cognitive restructuring, like changing the way of approaching things and situation. So your OCD recovery is also possible. All and above all, the good thing is everything that we provide as a process is completely online and available on your doorstep over your laptop. For more information, visit www.emotionoflife.in. For any inquiry, please call 936-850-3416. All the very best.